new year.
Hello and welcome. I'm Rick West, Mayor Chesapeake, and it certainly is my pleasure today to have with me at our second 2021 Roundtable, Mayor's Roundtable for the year. And at this session, I have with me, and pleasure to have with me, my good friend, former colleague, Dr. Jared Cotton with the Chesapeake Public Schools. We have asked him to join us today so that he could talk about some of the hot items that are in our schools and many of you know about today. So, Dr. Cotton, welcome and thank you for being here. I will let you all know that we are 6 feet apart, so we can do without the mask. It can help make us a little more understandable. So Dr. Cotton, thank you for being here, and thank you for wearing your mask and for taking it off when you speak. So my first question to you, sir, is the Chesapeake Public Schools have started rolling out the coronavirus. In fact, there was an article in the paper today about that, and we had an earlier session with Dr. Welch. She talked about it as well. So the vaccine is being offered to employees. Can you tell us about it?
Yes, we're very excited. We got word from our local health department that they had 1,400 vaccines, Moderna vaccines available for our staff members. And of course, my staff worked over the weekend to pull it all together because obviously there's a lot involved. I heard in the earlier segment about how much is involved in preparing for a vaccine and all the distribution and all the planning. We do have the vaccinations happening today at Deep Creek High School, and the high school administration and the principal there have worked with us to get everything organized this morning. As a matter of fact, I'm hoping to go over there and just see how things are going here shortly as soon as I leave. We have 700 employees signed up to receive the first dose of the vaccine this morning. We also have a waiting list, 700.
Wow.
And what's amazing about that is they only had about a 24-hour period to sign up. So we've had over 700 express interest. And then, of course, we're going to have another 700 doses on Friday at Oscar Smith High School. And that number, we have just a handful left of those slots available. But the important thing is that we've scheduled 3 rounds. We have 3 groups that we're going through, and we've really set priorities based on the employees who work very closely with students and with a large number of students, and particularly our elementary teachers in the first round, but all of our teachers need to be in the first 2 rounds. But we also made sure we included our bus drivers, our bus assistants, our cafeteria workers, and our custodians, because all of these employees work very closely with students, and they're an important part of our support that we provide, and they're all involved in safety practices in our schools. So what we're excited about is this is just an extra layer of protection for our staff and employees, and this wouldn't happen without our great partnership we have with our local health department and Dr. Welch.
Yeah, and we did talk about that, and I think that was what's so cool about our health department and our city and our schools is that we have such a good relationship with her, and the fact that not every city is doing that, offering it to the schools, but because of our commitment to getting kids back in school as quickly as possible and doing it in a safe way. And by the way, you've done a great job at doing that and keeping them safe and making good, smart decisions with that. So it's good that we had that relationship so that we could get that number of vaccines. Obviously, 1,400, is that how many vaccines you have right at this point?
1,400 for the first group, but we have requested more for the second round. And then, of course, depending on how things go through the first round and second round, we will determine how many we need for the final round. We know that based on numbers we've seen that we probably won't get 100%, because keep in mind this is optional. It's not mandatory for our employees, even though we certainly encourage this because it's such an important mitigation strategy. What we've kind of learned from initial vaccinations, about 40 to 50% take advantage of it at the beginning. But after others get vaccinated, the numbers tend to go up to 60 to 70%. So we're certainly hopeful that we'll have many more who take advantage of this opportunity. But we'll know more after we get through this first round and move into the second round. And then, of course, the final round that we have planned is Group C. But certainly we're prepared to ask for even a 4th round if we need to. because we want to make sure that we provide the opportunity for all staff. And one of the things that's important to point out too that we've done is we've built in some virtual, what we call asynchronous days, meaning that it's not live instruction during certain days when we offer these clinics, because we don't want to have any teachers or staff members feel like they can't take advantage of the vaccine because they have to teach or they don't have coverage, or if they're a bus driver and they can't work it within their schedule. So we are working with our parents and our community to offer these asynchronous learning days or virtual learning days so that we can make it a great opportunity for staff to feel they can participate without worrying about, can I make it happen given my responsibilities and my daily job?
Right. You know, a couple of things I guess that come to mind. Number one is you mentioned the percentage of people that are willing to take it. I would think and hope but that your teachers particularly who know they're so close to the kids would be probably a higher percentage that feel, and probably better read than most, and so would have more information in terms of the benefits of the vaccination. So, you know, the other thing I wanted to ask you about, and we talked about it in the earlier session, and I've also talked with a city manager about the side effect. You know, my wife just had her second, and the second seems to, from the doctors that she's talked to, has a little more kick. And the day after, you may not feel so hot, and they have to miss work. So are you kind of accounting for that so that teachers will have some time to recoup if they need it?
Yeah, so that's another part of the reason why we wanted to have those virtual days, because what we have learned, and of course Trudy Gelderks is our nursing supervisor who's done an outstanding job through this whole process. And she pointed out to our group the very same thing that you're saying, that when they get the second dose, sometimes there could be, even sometimes with the first dose, there could be some sensitivity or some things that happen. So based on how that goes, they wanted to provide time for observation and to check in with people as they get their vaccines. So that's another reason why we wanted those virtual days, because we didn't want to have a situation where teachers needed to be observed, or they needed to have a little bit more time, or if they're sore and they need to go home, and those kinds of things. We're hoping that's not going to be the case widespread. Certainly we've heard that happens in some cases, and we certainly hope it won't be a lot of cases like that. But we wanted them to have the comfort in knowing that they don't have to return to work right away and go home.
That's fortunate that you have that ability to do that. That sort of works out quite well. So my next question is about online learning. Students have been learning online since the winter break. So what's the plan to bring option one students back to school?
Yeah, we did present to our school board this week that our school health advisory board, our SHAB committee that meets regularly, as well as our local health department, feels confident that we can go ahead and move forward with our plan to bring our students back starting January 19th. And that would be our elementary students coming back to 5 days a week, traditional, that's pre-K through 5. And our secondary schools, our middle and high school, will be back on the blended model, that's 2 days a week. With an asynchronous or student support day planned once a week that's built in, the same schedule we had before the break. We did build in these 2 weeks because in collaboration with the health department, we saw a rise in cases after the Thanksgiving holiday. And even though we did not see lots of transmission within our schools, the transmission happened out in the community, and we had staff members and folks coming in or exactly doing what we asked them to do, not come in because they have symptoms and things like that. So when we had those cases happening outside of school, it led us to have substitutes in place, and quarantines, as you heard Dr. Welch talk about, is such an important mitigation strategy. And based on actual data from after Thanksgiving, we said, let's go ahead and plan for 2 weeks after the winter holiday because of the travel and the gatherings. Because what we're finding is the majority of the transmission is happening in our community outside of school. And of course, we put down those 2 weeks of virtual just to deal with some of those issues. And of course, as we come back, we're hopeful that will have been the right call, and we'll see less cases entering our schools that we have to deal with. But But what I'm very proud of is every time there is a case in our schools, we handle it very quickly. We quarantine all of those who've been exposed, and anyone who's been exposed within 6 feet for 15 minutes or more are considered close contacts. And our health services department works closely with the health department to quarantine and address those issues. And since we do that so quickly, we're able to prevent any further spread in our schools. And of course, it is at times inconvenient to do the number of quarantines and things that we have to do, but we feel very strongly that the reason that we do that and we move as quickly as we do, that's why we have not had widespread transmission in our schools.
So let me ask you this, and obviously you were relying heavily on the health department information and Dr. Wilson, her advice as well. Is there a built-in number? In other words, how would you know that it's not working? It's time to back up. What do you have to do to reverse yourself on that?
Well, from the beginning, we did not put out a threshold or a set number. And lots of times we have speakers who come to our school board meetings who say that we said if we hit 10% or if we hit 5% positivity, then this is going to happen. We never said that. We did have a couple board members who asked if we would set a threshold, and we pushed back against that because this is a very complex issue, which means that we need to look at lots of different data sources and instances before we can make decisions. And when we started down this road in July, we had no idea what to expect because we've never done this before. The benefit we have in Chesapeake is we've had students in school since September. So we have actual data to tell folks what's happening in our schools and our classrooms. And we can monitor in-school transmission. We have information. If we had never returned students to school from the beginning, then we wouldn't have anything to go on. We would just have to base it on community spread only. But the CDC does tell us that the community spread and those metrics that we look at are important to look at, but they're not to be used to indicate in-school transmission. So we actually have data that we can use based on real students and staff in schools and real cases that we monitor very closely. So to answer your question, and again, that's the other thing that I get, back in November, we had an emergency school board meeting where we said, where I asked the board to give me permission to close individual schools or have individual schools move to virtual based on data and actual cases in those schools. And the board did give me permission to do that. But even before we move a school to virtual, we can move classrooms to virtual. We can move a hallway or a wing in a building. I know you were a principal. You could have the science wing could maybe go home on virtual if there's a concern. And then we can move to having a school go to virtual. And that's number one, based on safety. If we feel like there are cases turning up in that school that may be transmitted within that school, then we're going to very quickly move to moving classrooms, hallways, or the entire school to virtual. Now, some people in the community have said, but you've had an outbreak at some schools. We've had a small number of outbreaks, and many of those outbreaks have involved only 1 or 2 people in the building. So even though it says outbreak, it sounds like there's hundreds of people being infected. But an outbreak only takes one person to transmit it to one other person, and that's designated as an outbreak. So obviously we didn't need to close the whole school or go virtual for 2 people. But the second part of that is operations. If we have to quarantine several teachers in order to keep them safe, keep in mind they don't have the virus, we're just doing that to make sure that they're safe and to limit exposure, and we can't operate our school because we have 15 teachers on quarantine, then we may have to go virtual as well, because even though those teachers are on quarantine, they can still teach from home virtually as long as they're not sick. So we can use that option. So the 2 things we look at in moving schools virtual are safety, number 1, and the health department really helps guide us through that. And number 2 is operations, and can we operate efficiently with the number of people that have to be out of school?
Well, now this is interesting, because this is not the story that's told, and I think the devil's always in the details. Number 1, you use information that's pertinent to your situation, and the percentage of infections in the community do not necessarily reflect what's going on in the school. Number two, as you said earlier, you're able to provide an environment where they're less likely, perhaps, to transmit the disease than if they were home or in their own, out in the community. And then number three, you have the flexibility to react if things go differently than you anticipate. I'm not sure how it could get any better than that, quite honestly. That is very, very cool.
Yeah, we do try to continue to send that message. There's a lot of misinformation out there, and of course, people are concerned when they see the community numbers rise
Right.
like they are. So we try to keep reminding people that we're going to keep our staff and students safe, and we're going to base it on data that's actually happening in our schools, not things that could happen. It's based on things that are actually happening. And of course, the other very important thing to point out is that we have so many mitigation strategies in place that has really led to our success. We've put several safety practices in place in our schools. We have audit teams that go out to our schools. They manage to get to every school before the winter break to look for any problem areas or any concerns that need to be addressed. And those have been addressed with principals. And it's also been, that information has also been used to help us even shore up our mitigation strategies. We are going to purchase some dividers that we're going to put into some classrooms just as an extra precaution. Even though we're not seeing student-to-student transmission, we feel like having those clear dividers, I don't know if you've seen them, they'll actually put them on desks to provide extra layer of protection in those classrooms where they're only able to get the 3 feet of distancing, because of course 3 feet is acceptable with a mask for distancing in the classroom. The majority of our secondary classrooms, they have more than 6 feet of physical distancing because of the smaller numbers of students that are in the classroom. And of course, those that have a need, we're purchasing some additional barriers for that as well. We've also purchased additional PPE, protective equipment for certain staff members, because we do have staff members who travel from into several classrooms, especially at the elementary level. Mm-hmm. We also have therapists and other staff members who work very closely with students. And of course, we're providing additional masks that are even more supportive for safety practices that we're going to put in place as well. And again, what they were using has certainly been working, but we just want to increase the safety there based on feedback, and as well as the biggest thing is to increase their confidence that they feel safe and secure at school.
Well, and I don't really condemn people who have those concerns, because if you look at the media, it's always giving you information. I remember my wife and I sitting and watching the nightly news and watch the numbers when the virus was breaking out bad in New York, and people, it would just painted a terrible picture, and obviously that didn't or hasn't happened in Chesapeake. And so just because you see something on the news or read an article doesn't mean it applies for us. And again, I commend you for taking action that is addressing the problem in a reasonable and scientific way, and considering all these factors. Let me move on to sports. You've canceled winter sports, and Dr. Cotton, the sports in schools, how important that is to the parents, particularly that are to the many people that are out there do not realize just how important those sports are to those parents and those kids that are taking part of it. But you made a decision to cancel those. Can you talk about that?
Yeah, that was a tough decision to make. We've spent a lot of time looking at ways that we could make winter athletics happen for our students, because we know, as you said, it's so important. I worked with our high school principals as well as our athletic directors at the high school. We worked with our school health advisory board as well as the health department to look for a way that we can make athletics and sports happen for the winter season. We had to delay the start of winter sports for a period of time, because we had to determine what could we do to make this happen for our students. When I was talking to you earlier about all the safety and mitigation strategies we have in place in our schools, we didn't feel confident that we could have that same level of protection with athletics, especially when you're looking at those close contact sports like basketball and wrestling. And then there was some discussion about having our students wear masks during basketball and wrestling, and we felt very strongly that that was not a reasonable request to have someone play basketball with a mask or even and wrestle with a mask. So then, of course, our health department said that maybe we need to look at testing. Maybe we need to, provide a rapid COVID test for our students prior to each game. And of course, we explored the possibility of that, which led to cost involved as well as time that's required to do that. And in reality, our winter season literally has about 2 weeks left in the winter season. So with all that has to happen, we would have to have had all that in place by today if the decision was made on Monday for a very short 2-week season. And the reality is, if any one of our students test positive for COVID, then the entire team, as well as a team that they played recently, would have to be on quarantine for 2 weeks. And their season's 2 weeks. So, I mean, there was just one thing after another that, and it was very painful for all of us because we wanted to make it happen. We are committed to continuing to look for ways to make the fall season happen. And I know that sounds crazy, I'm saying fall, but fall was moved to February. So football and a lot of the sports that happen in the fall are now happening starting in February. So we decided that we're going to put our focus on making fall happen, and that's our hope. We're going to have an update to the board at the next board meeting, and we'll update the community. And of course, right after fall, we've got spring.
That's what I was going to ask. If the fall is in February, where's spring?
Yeah, spring is in the April.
Okay, still
time
April.
frame.
That's good to know.
Yeah, so we have work to do to make that happen, but I just want the community to know that we're going to do everything we can to make this happen safely for our students. It's just created a whole nother challenge for us because all of the things that we have in place in our schools, there's no way we can have that same level of safety mitigation strategies in place for sports. But we're trying to figure out a way that we can still make it happen and keep our students and staff and coaches safe.
Yeah, when you think about, you look at the sports at the professional level and even the college level, and with all the resources they have, I would say they've been maybe 75% effective. And you take a high school team, you lose a couple of kids, that's, they can't play. I mean, one of the national champions played with only having played 6 games. So I can imagine that it would play havoc at a high school level trying to work around, first of all, the mitigations, and secondly, if someone does get infected. So thank you for that. The next question, the pandemic required a big emphasis on getting students the technology they need to learn from home. Where are we with these technology resources?
Well, I have to tell you, a lot further along than we were at the beginning of the year and even in last spring as well. And I know that you're well aware of this, Mr. Mayor, because the City Council and the city manager helped support us with some CARES funding for technology purchases. But I'm proud to report that we're 1-to-1 K through 12. All of our students, we even have devices for preschool students, thanks to our partnership with the Mount Church in our community, who helped provide some funding for tablets for our preschool students. So I've said many times that we've had a 3 to 4 year plan that has turned into a 3 to 4 week plan because we had to very quickly pull together to purchase devices. The majority of these devices are Chromebooks that were provided for our students, but also we purchased close to 3,000 hotspots for our families because the devices are not as helpful for our families and students who are working virtually if they don't have internet at home. So we've had close to 3,000 hotspots we purchased. A large number, I think around 400 of those were donated through our Chesapeake Education Foundation. So we've been really pleased that we've had community partners like the Mount Church and our Education Foundation really step up to help us provide access for our families, and because we didn't want any of our families to feel like they couldn't choose the virtual option because they didn't have the devices or the technology at home. We also know that, as you've mentioned earlier, we had the 2 weeks of virtual for everybody. So obviously everyone needed devices and access at home. in order to participate during that 2 weeks. Very different from what we faced last spring. Last spring, we had to prioritize families who did not have any devices, and of course, we weren't able to tackle the internet problem with many of those families. So we've come a long way since last spring, and I'm proud of the work of all of our staff who came together, the technology department, but we have staff in every one of our schools who've been a part of distributing devices and the technology and making sure that all of our students have what they need to stay engaged in learning. And the good news about all of this is when all of this pandemic passes, which I hope will be at some point in our future, a very near future, is we will always have the opportunity to engage students virtually if we need to, if we have closures and things like that. I'm not saying we're taking away snow days, because we all need a snow day every once in a while for sure. But there could be, we've had some situations where we've had hurricanes and other weather warnings where we've had to send students home. It's nice that we can now keep our students engaged if they have to be home for a period of time. And also we have students for various reasons who need to work from home, whether it's health or medical or any other kind of reason where they can stay engaged in learning, whether they're at school or at home. So beyond all of this, we're going to be in a much better place, and not to mention all the exciting things that we're going to be able to do now with our students having one-to-one technology in place.
Well, as we go closer as a city and as a region in providing this access to rural areas and better connections throughout, the possibilities are enormous for the schools, for the medical field, for industry, for our whole region. So I think it's sort of, we'll look back and say this was a good introduction into perhaps teaching a different way. And as you said, we probably don't even know all of the advantages that we'll be able to take as a result of growing having a better ability to provide technical services.
And we've even purchased cameras for our classrooms, which is interesting because especially for many of our secondary classrooms, which is, we thought, how are we going to because it's all been about serving the needs of our students and our families. And what we've had at the middle and high school level is we've had families who have selected in person and some who've selected virtual or online, and we've had some that have switched from in person to virtual, and limited number going the other way because we have to keep those numbers down in order to have in-person instruction. But our teachers are actually teaching students now that are in class and at home at the same time, which is very challenging for them to do. And our teachers have done an incredible job to make that work. And I know when you and I were teachers, we just had to worry about the ones in front of us.
Right,
now they've got some at home, they've got some in front of them. But we've purchased these cameras that actually move and follow the teacher, and the teacher has a mic or a lapel mic that so that students who are learning from home can follow along with what's going on in the classroom without the teacher having to stay in front of the computer screen in front of the room, which they've had to do for a period of time. So from what I understand, those cameras just started coming in recently, and they're being installed in our classrooms. So that creates a whole nother piece of technology that will be available beyond this pandemic as well.
So let me make sure I understand. So before, the teacher had to teach a lesson live and then prepare a lesson separately and do it virtually. And now with these cameras, the idea that they'd be able to do all in one. Is that correct?
Well, actually, they've been teaching it simultaneously, but they had to stay
in front of the camera.
They had to stay in front of the camera because, when you do a Zoom meeting or webinar, you stay in front of the camera. Right. So they were really tied to that teacher station. But now with these new cameras, our teacher's going to be able to be more mobile and walk around the room. So we're feeling like that's going to work a lot better than what we have in place. But I want to go back and say our teachers have made it work without those cameras. So it's important for our community to know that, and I've gone to schools to watch our teachers teaching that way, and it is very challenging. It's hard work, and just seeing the commitment and the excitement and the effort that our teachers are putting in, even though it's difficult, they know how important it is and how important their job is to provide that instruction to our students, whether it's in person or at home. and that's causing them to have to do double duty. But I would like to just give a shout out to our great teachers who are
Well, I'm
doing a
glad
good
you
job.
shared that with me. You know, most of my meetings, particularly all the regional meetings with the Hampton Roads Transportation, Hampton Roads Economic Alliance, the Harumpha, the Military Alliance, we have many regional organizations that I have to attend, and they're all are either Zoom or call in, and so I'm thinking in my head, is there some way I can not have to stand in front of that camera to get advantage? So I'm going to have to learn from you. So during the pandemic, we've seen that getting input and information to a wide variety of community members is important. And you, just like us, we talked about as a city getting word out about the shots and vaccinations and so forth. It's a challenge. So what are you as the school system doing in this regard?
We have created lots of avenues to gather feedback. Something that we've spent a lot of time doing is collecting questions. And on our website, we've been posting frequently asked questions from parents, staff, as well as students. But we also planned employee forums and family forums. When we gather up these questions, we do provide, we get a group of panelists together, and we present information through employee forums and family forums, and then we record those and we make those available on our website. We just did one recently for the employees, and Dr. Welch and the health department participated with us to share information and answer questions about safety and protection and those kinds of things. But we also value the two-way communication. We have a Let's Talk feature on our website where we gather information. It can be anonymous. You know, we have people all the time who say that they would like to share information anonymously, and that platform provides that opportunity where we can receive requests or questions anonymously, and we can even respond to them. And we have no idea who they are, but we are responding to their questions and concerns. And then when we get a certain number of questions, those become our frequently asked questions that we start adding to our group, our website that we put out so that everyone's well aware of those things. We've also added a quick tip on our data dashboard that we have for our COVID-19 numbers. We added a quick tip feature there so our staff members and community members can report any safety concerns that they have. And that's important because sometimes we'll get an email from a parent when they say, I'm concerned that one of the safety measures is not being followed in a particular school. So they can report that on the quick tip on our dashboard, and that goes directly to that school's principal. So the principal can address that concern immediately so that can be addressed. So we wanted to add that piece as well. We certainly have opportunities for our community members to talk at board meetings, but we also added several features on the school board website where they can record a message that can be shared with our school board, and we've had some members who have taken advantage of that. Of course, emails and contact information for all of our board members are included on the website. And of course, we have speakers who come to our board meetings and they can speak, and we've put several practices in place to keep visitors safe. They're separated, everyone's wearing a mask, and they get safety checks and health screenings before they come into the room. So we've been doing that for the last few months. But we do have folks who don't feel comfortable coming into the meeting, and that's why we added the video ask feature where they can do a recording of their message that is shared with the board prior to the school board meeting.
You know, one of the things, I think there was a newspaper article about our decision not to have citizens come in, school systems to come in, but I think people don't realize that there are different circumstances. You're not auditorium chairs like we are. You can move your chairs around. I did watch the school board meeting where you have them separated into twos and that kind of thing. I'm not sure. I don't think your boardroom is occupied like this one. We have enormous number of groups and boards, commissions, the planning commission that use this very dais, and so for us to have continued with citizens coming in, it's almost impossible to keep it at a level that I would feel comfortable with the public coming in. So, you know, there are things about our circumstances that are different, and people wanted to make it a lot of it one way or the other, that the school system shouldn't be allowing citizens in, or that the city should be. But the truth is that we are dealing with two totally different types of circumstances, and I think our decisions were both appropriate. And sometimes I can't always look back at a decision and say we made the right one, but I think on this one we did.
Yeah, what's important to know is we get lots and lots of feedback, and we carefully review all the feedback we receive. So we receive feedback in many different ways, and we've created lots of different avenues for folks to share their feedback. And of course, that's the most important thing that the community needs to know, is that we certainly look at all the feedback we receive and we act accordingly.
You know, we continue to be proud in Chesapeake of our school system. Certainly proud of your leadership and our school board, their leadership, and doing the right things for the right reasons, Dr. Cotton. So thank you again for being here, sharing your thoughts and all the things that you're doing, and hopefully we can continue to do this.
Sure, and I appreciate that. And just to reiterate, we value in-person instruction, so we're doing everything we can to make it happen for those families who've selected that option. And there's all kinds of stats about how important in-person instruction is. Online learning works for many students, but not all. We need to provide some level of in-person, and we're committed to doing that. And it's more challenging for us to do that. But I'm very proud of our staff and our school board and the health department and all of us working together to provide this opportunity for our students. And it wouldn't happen if we weren't all working in partnership to make it happen. But thank you for inviting me today.
Yes, sir. So this concludes our emergency roundtable session today. I would like to end by saying a couple of things. Number one, continue to wear the mask, continue to keep your distance and wash your hands. We do have help on the way, vaccinations. I'm very excited about the school system being first in line to start their vaccination process, and really proud of that. We appreciate you tuning in, and hopefully we answered your questions. If you have feedback that would like to provide us for this program, we're certainly willing to listen to it. And until then, thank you very much for joining us.